So I'm Dr. Parony Bilke. I'm one of the clinical advisors at the College of Optometrists.
And I'm Daniel Hardiman-McCartney, also one of the clinical advisors at the College of Optometrists.
So firstly, really like to thank you for your efforts and time to actually read through and listen to our guidance and the hard work that you've been doing across the UK to make sure we can provide eye care safely.
As all parts of the UK are unlocking and stepping down wider restrictions, COVID restrictions in society, we wanted to release this video today to confirm that in optometry healthcare settings, it's important that you continue to follow the college's amber phase guidance and your own nation's standard operating procedure.
So while it's really important that all clinical staff and practice staff wear fluid-resistant surgical masks when providing care less than 2 meters, it's your decision, based on a risk assessment, to decide when to use gloves and aprons. Now, gloves and aprons should be disposable, and this means that it should be decided to be worn when you anticipate exposure to blood and bodily fluids. Now, although this is unlikely in optometry practices, it can happen if a patient, for example, experiences lots of epiphora, and in that condition, such as conjunctivitis, you might want to wear gloves in that instance. However, you can choose whether or not to wear gloves or adopt a really fastidious hand hygiene protocol. However, it's really keen to make sure that everyone is aware using gloves or aprons doesn't preclude the need to adopt really clear hand hygiene. So make sure you disinfect your hands before and after the procedure. Once you've completed the procedure, remove your gloves and apron and discard of them after conducting it or before the patient leaves, if that comes sooner.
When considering what products to use to disinfect hard surfaces in your practice, we've updated the amber guidance. We've done a review of the evidence and the risk of formite transmission. We still continue to recommend products with over 70% ethanol and more than 1,000 free parts chlorine. However, we have made, in addition to that, the recommendation that practice could choose to use any product that contains a CE or UKCA mark as being suitable for SARS-CoV-2. So that enables you to have a wider range of products available, some of which are quicker and easier to use. However, it is very important to follow the manufacturer's instructions. So with some of the wipes that are available, that they do recommend a certain contact time that needs to be made for them to be effective. You can read more about it in the updated amber guidance.
So based on our updated guidance, practitioners can now choose whether or not they decide to use microblepharoexfoliation for treating blepharitis and alga brush for removing rust rings from the cornea. Now, while these aren't specifically identified as an aerosol generating procedure, it does involve the use of a high-speed device that may produce biological debris, such as tear film and blepharitis crusts that get spread and dispersed around the room. And for that reason, optometrists should wear the appropriate PPE and adopt the correct IPC procedures to make sure they keep their practices, their patients and their staff safe. All the detail of what this entails is included in our new amber update guidance.
So triage and prioritization remain important in all 4 nations. Triage is important to ensure that patients entering practice do not have any symptoms or live with anyone who may have COVID, and that ensures that you keep your practice safe and in the medium risk pathway for IPC purposes. Prioritization also remains in each of the nation's standard operating procedure or supporting health system guidance. How you choose to do prioritization will depend on how your practice is set up and the systems and software that you have in place. We have a very handy flowchart as part of the college amber guidance that you can follow. We haven't changed that flowchart, but what we do want to emphasize is actually you can delegate the role of that prioritization to suitably trained practice colleagues to ensure that you have enough time to be delivering eye care and not spending lots of time on the phone doing triage unless it's absolutely necessary. So we wanted to emphasize the point to support practices to best use their resources, that prioritisation can be safely delegated under your supervision to suitably trained members of staff. You can read more about that in the updated college AMBER guidance.